Welcome. Today we're diving into the fascinating yet serious world of hypertensive retinopathy. This condition affects the retina, the light-sensitive tissue at the back of your eye, and it's directly linked to high blood pressure. Join us as we explore what causes it, how it develops, how it's diagnosed, and what can be done to manage and even prevent it. So, what causes hypertensive retinopathy? The primary culprit is, as the name suggests, chronic high blood pressure, also known as hypertension. Over time, sustained high pressure damages the delicate blood vessels in the retina. This damage isn't a sudden event, it's a gradual process, often developing over years of uncontrolled hypertension. The severity of the retinopathy often correlates with the duration and severity of the high blood pressure. Let's delve into the pathophysiology, or how hypertensive retinopathy develops. Uncontrolled hypertension causes a cascade of changes in the retinal blood vessels. Initially, the arteries constrict, a process known as arteriolar narrowing. This is the body's attempt to protect the fragile capillaries from the high pressure. Over time, the arterial walls thicken and become less flexible, a process called arteriosclerosis. This rigidity can lead to compression of the veins where they cross the arteries, a sign called AV nicking. As the damage progresses, the blood vessels can leak, causing hemorrhages and exudates, deposits of fluid and proteins to appear on the retina. In severe cases, the optic nerve can swell, a condition known as papilledema, which can significantly impair vision. Epidemiologically, hypertensive retinopathy is a common finding, especially in populations with high rates of hypertension. The prevalence increases with age and is significantly higher in individuals with poorly controlled or untreated hypertension. Certain demographic groups, such as African Americans, who have a higher predisposition to hypertension, also exhibit a higher risk of developing hypertensive retinopathy. Furthermore, individuals with co-existing conditions like diabetes are at an even greater risk, as both hypertension and diabetes can independently damage the retinal blood vessels. The signs and symptoms of hypertensive retinopathy can vary widely depending on the severity of the condition. In the early stages, many individuals experience no noticeable symptoms at all. This is why regular eye exams are so crucial, especially for those with hypertension. As the condition progresses, symptoms may include blurred vision, decreased visual acuity, headaches, or even sudden vision loss in severe cases involving hemorrhages or optic nerve swelling. It's important to note that these symptoms are not always specific to hypertensive retinopathy and can be indicative of other eye conditions as well. Diagnosing hypertensive retinopathy involves a comprehensive eye exam. The eye doctor or ophthalmologist will use an ophthalmoscope to directly visualize the retina and its blood vessels. They'll look for characteristic signs such as arteriolar narrowing, AV nicking, hemorrhages, exudates, and papilledema. Fluorescein angiography, a procedure where a dye is injected into the bloodstream and images are taken of the retinal blood vessels, may be used to assess the extent of damage and identify areas of leakage. Optical coherence tomography, or OCT, is another imaging technique that provides detailed cross-sectional images of the retina and can help detect subtle changes in the retinal layers. Hypertensive retinopathy is typically classified based on the Keith-Wegener-Barker classification system. Grade 1 involves mild arteriolar narrowing. Grade 2 includes more pronounced arteriolar narrowing, along with AV nicking. Grade 3 features hemorrhages and cotton wool spots, which are small areas of retinal ischemia. Grade 4, the most severe stage, involves all the previous findings, along with papilledema. This classification helps in assessing the severity of the condition and guiding treatment decisions. The primary goal of treatment for hypertensive retinopathy is to control the underlying high blood pressure. This often involves lifestyle modifications such as dietary changes, regular exercise, and weight management. Medication is often necessary to achieve adequate blood pressure control. In some cases, particularly those involving significant retinal damage, laser photocoagulation may be used to seal leaking blood vessels and reduce edema. In rare cases, a vitrectomy, a surgical procedure to remove blood from the vitreous humor, the gel-like substance in the eye, may be necessary to improve vision. Prevention is key when it comes to hypertensive retinopathy. Regular blood pressure monitoring is essential, especially for individuals with a family history of hypertension or other risk factors. Maintaining a healthy lifestyle through a balanced diet, regular physical activity, and avoidance of smoking can significantly reduce the risk of developing hypertension and, consequently, hypertensive retinopathy. Adhering to prescribed blood pressure medications and attending regular eye exams are also crucial preventative measures. The prognosis for hypertensive retinopathy depends on the severity of the condition and the effectiveness of blood pressure control. In many cases, with prompt and effective management of hypertension, the retinal changes can be stabilized and vision can be preserved. However, If left untreated, hypertensive retinopathy can lead to significant vision loss. Recent research has focused on identifying biomarkers that can predict the development and progression of hypertensive retinopathy, allowing for earlier intervention. Additionally, studies are investigating the potential of novel therapies to protect the retinal blood vessels from damage caused by high blood pressure.